Okay, now let's come back to the conference. So the next session is the Alumni Symposium. It's a share and learn the coping experience in new normal. We have 5 doctors who graduate from Faculty of Medicine, Burapha University. 2 are Thai and 3 are from Cambodia. So let's start with the experience in Thailand. Dr. Rawit Pantong, could you please?
Okay. We have a 3 part, like education part, physician part, and a living part.
So Dr. Rawit Pantong will share the private sector experience in Thailand. So please, Dr. Rawit.
Everybody to hear me, right?
Yes, we can hear you.
Okay. Now I work on a private clinic, primary care clinic, mid-May clinic. My clinic had to manage to train a lot on the COVID-19 crisis on this situation. My clinic had to manage to make a system, drug delivery system for green case patient like a well-controlled diabetes and well-controlled hypertension disease, and have a make telemedicine system and an infection control on my clinic, like a ARI clinic on outside of my clinic. And I have learned a lot of new things on this situation, and many things make it more convenient for patients to access health system on Thailand. But the problem of my clinic is a policy of a public policy, like a home isolation policy, PCR test policy. There are many have a lot of problem, because when I have a patient confirmed case COVID-19, I cannot transfer to a public hospital or home isolation system of this policy.
Okay, so the next sector is the experience in the public part. Dr. Parit, Phongam, can you give me the experience about it, please?
Yes, thank you. Firstly, let me introduce myself. My name is Parit Phongam, and I'm graduated from Burapha University. Now I'm work as the occupational medicine resident in Queen Sawangwattana Memorial Hospital. This hospital is operated by Thai Red Cross Society, and this is the place for the medical student of the Burapha University to join and perform the clinical practice in the 4th to the 6th year. So, okay, as all we know that our province, Chonburi province, is one of the top 5, the most reporting confirmed COVID-19 cases for today. So in my aspect as the doctor in the public hospital, since I studying in the Burapha University, I was growing and learn about the preventive medicine. So now I'm work at the occupational medicine resident and perform the occupational health care and safety and provide the safety for the healthcare worker. So the new normal of our work is very vicissitude. So we use the telemedicine to take the history from the patient in the ARI clinic. The ARI stands for the Acute Respiratory Illness Clinic. And we use the triage criteria for the risk assessment and use the telemedicine as the equipment for reduce the exposure of the COVID-19. More than that, our hospital was received the modular swab unit. This is the room for to perform the nasal swab PCR test. This room can provide the safety to the healthcare worker. This room is the separated area for the doctor and patient, and is including the pressure control, the engineering pressure control to divide the isolated patient and the doctor. This is we use in the hospital. More than that, we, as the occupational medicine physician, we have to receive the consulting from the hospital. And last month, the Ministry of the Industry and the Ministry of the Public Health agreed to implement the bubble and seal. This is the measure to prevent the COVID-19 from spreading in factory. The factory providing the on-site accommodation for their workers is the seal method. This would be used to prevent the worker from leaving the hospital. Under the measure, employees with the different level of the COVID-19 risk will be grouped and stratified to reduce the possibility of the infection among them. However, all the employer can work as the normal under the measure, so the operation will not disrupted. So this is the one of the BCM. The BCM stands for Business Continuity Management of the factory. In addition, the grouping in the bubble and seal measure, the employer must surveillance for the symptom and sign and check using the antigen test kit. The new staff will be quarantined for 14 days. About the COVID-19 control in workplace, our government launched the measure about the precautionary measure of the COVID-19. It's called DMHTT. The first D stands for the distancing. Every worker in the factory have to maintain the social distancing and avoid close contact with others. The second is M. M stands for mask wearing. As the occupational medicine physician, we have to implement this and teach the patient how to correctly wear the mask wearing. So H stands for hand washing. Use the alcohol-based hand sanitizer containing at least 70% alcohol. And the first T, testing, is about temperature and get test the COVID-19 as mentioned in the criteria of the government. And the last T is Thai Chana application. This application can scan and check in and use and give us the information how to track the cases and how they spread in the society. Thank you.
Okay, thank you very much, Dr. Parit. So the next we will learn experience from our Cambodian alumni student that graduated in our faculty. Dr. Meas Sopitou, please, can you give us the sharing experience?
Hi, can you hear me?
Yes.
My name is Sopitou, and I was a student from the Faculty of Medicine, Burapha University. I was in class 2020. So the pandemic hit right before I graduated. And right now I'm working at a private hospital in Phnom Penh, Cambodia. Well, let me just say that right now, my hospital doesn't really accept or admit COVID positive patients, but it still doesn't stop, PUI or patients at risk from coming in seeking consultation and treatment. So basically, I'm still at risk. Like it's not like a higher risk as my fellow doctors at the public hospitals, but I'm somewhat at risk. And my experience so far has been, in short, I guess I have been coping with this whole pandemic thing. At first, it was like really stressful because I was at risk from seeing the patient, but since my hospital doesn't accept COVID-19 positive patient, we still had to send them to COVID-19 centers that accept patients. And it was hard, telling them that we can take them in and then they have to be sent over to another place for treatment and stuff like that. But yeah, and so far it has been like several months now, and I guess I'm dealing with it better now. I guess I'm coping with it. I can say, and yeah, I guess overall my experience as a doctor at a private hospital, it has been a little stressful, but manageable. Thank you.
Thank you very much, Dr. Mia. So finally, we move to Dr. Koem Chanthorn from Cambodia also. Can you give us the experience about the COVID-19 situation?
Yes. Okay. Good afternoon, everyone. Can you hear me, please?
Yes, we can hear you.
Okay. Let me introduce myself first. My name is Koem Chanthorn. I was a medical student at Faculty of Medicine, Burapha University, 9th generation, and I just graduate this year is 2021 during April. So actually, the COVID-19 pandemic, because of the COVID-19 pandemic, after graduation, I cannot come back. I cannot come back to my country. I need to wait until the situation of COVID-19 in Thailand getting better, and after that, finally I can come to my country during July 15. So I'm such the young general practitioner. For now I didn't have much experience about the COVID-19 situation in the hospital yet, but right now I would like to share my short experience about the quarantine, my personal experience as a passenger. So during before as you know, the COVID-19 pandemic affect many domains or many sections in our society, especially during the traveling. And for the traveling across the country, the two documents that we need to have is the first one, passport, and the second one is COVID-19 PCR test, which has the negative result and must not over 22 hours. It means that before we depart from I departed from Thailand to Cambodia, I need to do the test, and the result might get between 3 days before I came. For the method of come to Cambodia from Thailand, we have two methods. The first one is the flight. and the second one is by bus. If you catch the flight, the destination will be go to the Phnom Penh capital city, and they will provide you the quarantine place there. But for me, I came home by bus, and I need to stay at the Parit international border, and there I need to take the quarantine there. The quarantine in Cambodia, there are also such similar to the quarantine situation in Thailand. There are two types of quarantine. The first one is state quarantine, which is the place that the state or healthcare authority of Cambodia provide you free to stay. But you also had a choice. We also had a choice. Is the second place is the alternative state quarantine, which is we need to spend the price. The alternative state quarantine, such as the guest house and hotel, which has the better condition if we compare to the state quarantine. So before getting to the quarantine, when I arrived at the border, I need to take the rapid test for COVID-19 again, but just the rapid test. If the result is negative, then they will send me to the alternative state quarantine area, and I stay there for 14 days. And after that, after full 14 days, we need to do the PCR test again. And if the test is negative, the authority will provide us the medical certificate to confirm that we have stayed safely and for 14 days at quarantine. And after that, after we got that those documents, you can travel to your final destination, your homeland. For the problems that I met during my quarantine is they caused me anxiety because of the two things. The first one is
Dr. Chanthorn, can you open the microphone, please?
yes.
Okay,
Yes.
thank you.
Okay. The first one is that make me worrisome is about the COVID-19 infection, and the second one is the stress during quarantine. What I learned and experienced about the coping, all those things is for the COVID-19 infection, I have strictly follow the recommendation of personal protection, such as frequently washing my hand, wearing the mask, and keep social distancing, and minimize talking to others. For one more thing is that I want to focus is the stress management for the passenger during the quarantine, because the 14 days is quite long enough. If we stay only in the room all day. For my coping strategy is I had two two things. Is the first one physical, and the second one is mental, and it's quite helpful. The physical for me is I manage the time to take the exercise and got enough sleep and take some time to entertaining yourself, such as music and movie. And for the mental problems, for the stress management, the first one is I did talking to my roommate, because they allow us to live to stay two people in one room during the quarantine. So I got a chance to talk with my roommate and exchange the experience with them, and furthermore with my family, with my friends, and so on. One more thing is learn new things. If I did learn new things when I stay in the quarantine, such as about the financial management, about life planning, and about the drawing. I noticed that this method can reduce the stress and can give me the life that
Dạ, em cái kêu lư chạy chứ mà kim văn hảo này. Hả? Tôi nay cái kia hảo thế à? Em đi mua rồi.
All those methods that I talk about, this can help me to reduce the stress and coping with the stress during the quarantine. Thank you so much.
Okay, thank you very much, Dr. Chanthorn. So if there are any questions, you can leave it on the chat box or raise your hand, and you can talk and ask the panelists about their experience or anything. So let's, I have the question to Dr. Rawit and Dr. Parit, that because you work in Thailand, Dr. Rawit is working in the private sector, that in the clinic in Nonthaburi, right?
Yes.
And Dr. Parit is working in the government sector in Sriracha. So what I would like to ask about the problem about is there any problem about the financial or any reimbursement about this situation when you have the patient that you have to admit to the hospital or the clinic, or if you don't have any place for them to go, so like in Bangkok, because there are a lot of patients, so you send to the patient to anywhere or let them go home for home isolation or anything?
Okay. When we have a COVID confirmed case on the Nonthaburi, in my clinic, MedBUU clinic on the Nonthaburi, have a policy on Nonthaburi. If we have confirmed case, we just send a pill to a home patient. My clinic pill, not a public pill, because a public just only have a favipiravir, but don't have a policy to receive a patient COVID confirmed case, because on Nonthaburi is a very full situation. And if stable case, if have a stable case on my clinic, I just send a pill to home patient and I consult by myself on MedBUU clinic application telemedicine because on Thailand have a law of telemedicine, right? We cannot consult by phone. We just consult by application telemedicine because we have a record, medical record on application, and I just only take a pill and take a consult. But if my patient is worse more than before, I just tell a patient need to call 130 to go to a register to public sector. And if very severe, maybe I suggest patient go to public sector to admit emergency room. ครับ thank you.
So that means when you have the confirmed case, you just send them home.
Yes.
And then you even though they are in the yellow or the red, you don't have any, any transfer to other hospital or make them in the treatment. So when I listen, I think that it's only you just give them the symptomatic medication, right?
Yes.
And it's not count in the confirmed case or count.
Not count because the patient just register by themselves to
I see.
To send to a register home isolation system. But if I found on my clinic like a yellow patient or red patient, maybe I refer to a private hospital, and private hospital just maybe go to home or admission depend on that public hospital.
Dr. Rawit, which province do you live now? Province.
เมืองนนทบุรี
There has a lot of case of COVID-19 infection.
On my clinic allow 20, but now I have 3 to dead patient.
You have 20 cases
Yes.
of the day or 20
No.
cases?
On allow 2 months.
Around 2 months. But 3 cases was dead.
Yes. But not MedBUU clinic have a lot of branch, right? But on Pathum Thani it's very worse than Nonthaburi. Pathum Thani have a lot of case, like around 50 confirmed case on that clinic. Every day we will send the pill every day, and we just need to connect with the public sector to transfer patient to the public sector because we don't have a resort, everything like we don't have oxygen, we don't have a car to transfer to a public sector, we don't have a community isolation or home isolation. Depend on I think everybody physician can see about this situation on Thailand. Have a lot problem.
Do you feel uncomfortable for treating COVID-19 patient?
A little bit because when we have a severe case, I have a plan with my team. If we have a severe case, how we do with that patient, and my team suggest about if really severe, maybe we cannot take intubation because if I take intubation but don't have a ventilator to help that patient. Maybe I just think I can only consult about that really severe to treat.
Okay, what about you, Dr. Parit? Is there any problem in your hospital that are fully of patient, or you available any bed?
Okay, thank you, Dr. Trakan. The big problem in my hospital is the limitation of the place to admit the COVID positive patient, because in my district, the Sriracha district, there are almost 200 the COVID positive patient per day. So about the hospital, there is the limitation of the place for the admission. So we got the triage team for the risk assessment based on the clinical and investigation like the chest X-ray and the risk factor like the chronic underlying diseases or the pregnancy or the severe symptom. We stratify and classify the risk of the patient into the yellow, green, yellow, and red. So we triage the patient and prioritize the first to come, the most severe symptom to the hospital first. And this is a big limitation is to arrange the place to admit the patient. But now we setting the system for home isolation and community isolation run by our family medicine physician team, and factory accommodation isolation FAI run by occupational medicine physician team, and the hospital run by others doctors in the hospital. And we isolate the sick patient in contagious period to the area, the appropriate area for admission. So this is how we adapt the protocol from the government.
So that's mean you have hospital, you have the home isolation, right?
Yes, and we have the call center for the patient that they can call for asking the question about the self-care, and we have the line group for the community and home isolation, and also factory accommodation isolation.
And you say that you have the BCM for industrial.
Yes,
and
yes.
you say that you have to taste the COVID antigen. So I would like to know that how often that we have to do it for the patient who can go back to work.
About the patient, about the return to work, we use the guideline for the CDC, and we discussing the risk with the factory, with the hospital. Some places use the 14 days for the isolation, but some places use only 10 days return to work in COVID positive patient in condition with stable, clinically stable.
Okay, so let's go to Cambodia. So Dr. Koem, you work in the private or the government hospital? Oh, you did not work yet?
Yes.
Okay. And what you plan to go?
Actually, right now I plan to I am applying to both state hospital and the private hospital. During this time, I am also finding the work at the clinic too.
Okay, so I've heard that in Cambodia you vaccinated a lot. What about the care worker in hospital? Which vaccination that you have? Is it a mRNA or viral vector or the
Actually, here we got for the healthcare worker, we got for the first time we got 2 doses of Sinovac, and right now mostly got the booster dose from the viral vector is AstraZeneca, and that's for healthcare provider, and for the general population, some area they got Johnson and Johnson, because it is only 1 shot and no need to booster, and some area also get the Sinovac.
So I know that did you just already graduated from the Faculty Medicine of Burapha University? You can explain the experience between Thailand and Cambodia about the COVID-19 infection?
Thank you for your question, teacher. Actually, the risk of infection in Thailand and Cambodia, if we talk about the number or amount of the patient, Thailand is higher than Cambodia, and if I think if we compare about the rate of infection, it's quite similar, and the difference between the people in Cambodia and in Thailand, such as the previous speaker talk about the amount of vaccination in Cambodia, even though we got only Sinovac or AstraZeneca, but the amount of the general population that got the vaccination, at least 2 doses of Sinovac, is has got up to 80 to 90% of the population. So here the rate of the infection one more thing, the government of the Cambodia also do the method of lockdown for some period, and the method of finding the case during in the community, especially with the Delta variant. If they found the case in the community, we will take the patient to the quarantine or to treat in the hospital. The amount of Delta variant in Cambodia right now is a bit low in Cambodia. We didn't get much case that has Delta variant yet. Even though the government of Cambodia quite informed strictly about the recommendation, the personal personal protective method for the general population also. That's why the case in Cambodia increasing quite low.
Have any questions from the floor?
So thank you very much for experience in both in Thailand and Cambodia. If you have any help, you can contact us. We appreciate to help you both in Thailand and Cambodia.
Thank you.
Okay, thank you very much. So I would like to end this session and
ค่ะก็คิดว่าวันนี้ก็คือถึงเวลาที่ก็คงจะเราได้รับประสบการณ์นะคะจากชาติต่างๆในอาเซียนนะคะไม่ว่าจะเป็นไทยแลนด์เนาะประเทศไทยไต้หวันกัมพูชาอินโดนีเซียแล้วก็ลาวเนาะรวมทั้งน้องๆของเรานะคะนิสิตของเราที่จบไปแล้วนะคะไม่ว่าจะทำงานในลักษณะที่เป็นคลินิกเนาะก็จะพบว่าการติดเชื้อโควิด -19 เนี่ยมันก็สร้างความเดือดร้อนเกี่ยวกับระบบสาธารณสุขเราค่อนข้างมากนะคะรวมทั้งน้องที่ไปอยู่ที่โรงพยาบาลสมเด็จนศรีราชาเนาะแต่ได้ดูผู้ป่วยที่อยู่ในโรงงานนะคะก็พบว่าทางโรงพยาบาลเนี่ยจะต้องมีระบบทางสาธารณสุขนะคะที่จะดูแลผู้ป่วยกลุ่มนี้แล้วก็ต้องขอบคุณนะคะนิสิตของเราที่จบแล้วก็กลับไปอยู่กัมพูชานะคะ